Listen to that Foley work
Nice.
right there. It's good audio work here. Cheers, Greg.
Cheers, my friend,
To Seattle Study Club,
to the
because it
study
changed my
club.
life.
Welcome to It Comes in Pints, a Seattle Study Club podcast where we will explore a myriad of topics: clinical, health and well-being, psychological, education, business, and much more. I'm your host, Greg Tice.
My name is Joshua Austin. I'm a restorative dentist in San Antonio, Texas, and co-director of the ERDE Study Club, Excellence in Restorative Dental Education, chapter of the Seattle Study Club.
So I want to welcome everybody to this episode with Dr. Josh Austin, a friend of mine. And Josh, as you know, this is really designed to be more of like we're sitting in a pub having a conversation. If we're sitting in a pub, we have to have a drink.
Of course.
It's only about noon here. It's 2 there. You're still in the practice. So I'm assuming we're both approaching this from a non-alcoholic standpoint. But what drink did you bring today?
Unfortunately, yes. As much as I wish I could have a real pint of a proper ale, I've got a Pepsi Zero Sugar Wild Cherry. Little known fact about me, Greg, I do love diet soda. It is like one of my vices, but I'd much rather be having a beer with you.
I would much rather be having a beer with you as well. So I went root beer. At least I'm
Very
staying
nice.
in the theme there a little bit.
Good choice, yeah.
I am not a diet soda fan. A Coke Zero once in a while, but not happening.
I'm going to crack. Yours is already open, yeah?
Yes. Yep.
All right, I'm going to crack mine. Listen to that Foley
Nice.
work right there. It's good audio work here. Cheers, Greg.
Cheers, my friend.
To Seattle Study Club,
To the
because
study
it changed
club.
my life.
Love to hear it. Well, welcome to It Comes in Pints. But for our listeners, tell us a little bit about your background. You're a big advocate in the mental health space as well, especially for dentists and their teams. Tell us about that background and what sort of led you in that direction.
Yeah, so, I'm a second generation dentist, which I think a good amount of dentists identify with. The ADA says around 10% of dentists are second generation dentists. My dad practiced for many years in Amarillo, Texas, and then became a dental educator later in his life. And I went into dentistry as well. And I was fortunate because early on in my life, I met somebody named Bill Robbins, who you know as well. And
Yep,
Bill really showed me what the world of dentistry could be more than just handpiece and composite, right? And, more than that. And so I came out of dental school really excited about the idea of comprehensive dentistry, collaborative care. And because of Bill and Eric Rendler, who you also know, who is, those guys are also my co-directors in our study club here in San Antonio. I started with Seattle Study Club literally the year I graduated dental school. And it set me down the path. It gave me a foundation to start thinking about how I was going to build what I wanted for my dental career. And that involved more than just the drill and fill, more than just the single tooth dentist, right? And so Seattle Study Club's been with me my entire career since I've started, and teaching me those things about how to work on comprehensive treatment plans, how to think about comprehensive care cases, and then just obviously like adding new things every year. When I graduated from dental school, no one had ever heard the word airway before. It wasn't even a thing, right? And so now we're adding that. Digital smile design was like not even an idea of anything that would be possible, right? And now it's just a fundamental part of what we do. So Seattle Study Club is really responsible for growing me into my career. But I'm a high achiever, probably like a lot of people who are involved with Seattle Study Club. And that comes with curses. And one of the curses that it comes with is always measuring the weight of your own expectations, right? And so it's been something I've battled with, especially like kind of the middle part of my career and the last, let's say, 10 years. Has not been like the easiest thing when you like go to a CE course on a Friday and hear Christian Coachman talk about, whatever new DSD or whatever crazy new thing there is. And then you go back to your practice on Monday and you see what dentistry can be, and you realize that you're not there yet and all that. And so I've dealt with, depression for a lot of my career. And I think that's something that a lot of dentists do, and the data backs that up. And so the kind of journey I've been on the last 5 years or so is trying to spread the word about, hey, it's okay. And here's what we do to try to help it and take care of ourselves.
So a couple of things there. First, love Bill Robbins, Eric Rindler, not so much.
So you have no idea how often I hear that.
In fact, we celebrate Bill's anniversary every year at Symposium.
Every year at Symposium, yeah.
Yeah,
It's one of the hallmarks of Symposium. Your
it is.
birthday, and then Bill's anniversary.
Don't tell everybody about my birthday. I don't need to get any older, so we don't need to celebrate that. But based on what you were saying, so a couple of questions, because there have been a number of clinicians I've known over the last 30 years in the network who've struggled similarly. And back in the day, we didn't really have the vocabulary to talk about it. So it was always, well, they're a perfectionist, and that's what's driving this mental challenge that they're facing. Is there better vocabulary to use now? Is it still related to, I want to be that good, I'm a perfectionist, and because my work sucks, which it doesn't, but my work sucks, I'm a terrible human being?
Well, I think part of that is like we suffer in this world now of like where we are all consuming everyone's highlight reel on this stupid thing called Instagram. Yeah. And so you get shown on Instagram, or you go to Symposium, you see all these beautiful cases, and then you think of like every crown prep you've ever done that doesn't look like that. Like not knowing that the persons who is showing these beautiful slides of these beautiful cases also have cases that didn't go as well. That's why they're not on the slides. You're just seeing the good ones. And so there's always some kind of bias with that, right? We always judge ourselves against everyone's highlight reel. But yeah, I think, we're in the day and age now where we're really realizing how important previous trauma is, psychological trauma is, that we all have in our lives, the terrible things that happen to us and how they shape the way that we think about things, our emotional reaction to things, and the way that we make decisions about things going forward. And we all learn like coping mechanisms and protective mechanisms to help us through those times that we then use during other high stress times, like when a crown prep's not going as good, or an implant fails, or somebody breaks a veneer that you just did, anything like that. And so, the idea of having to process our traumas, I think, is a fairly new idea. Especially to dentists, and having to do work on the things that happened to us when we were younger and earlier in our days, because that shapes who we are now and how we react to things now.
You present to a lot of clubs, about mental health.
Yeah.
Was it a progression for you? Was there a pivotal moment was there an aha where you went, oh shit? Like what was that journey like for you?
So I had gone through the depression and the diagnosis, and then trying medication, not really working and failing pretty hard, and then going through therapy and having some success with therapy. And so I wanted to share that word. And it all started pre-COVID. It started February of 2020. I had a event at a very small meeting where I kind of knew everybody, and they had challenged me. They asked me to speak at the meeting. They wanted me to do 30 minutes, and they said, we want you to do 30 minutes you've never done anywhere before. Totally something new. And I didn't know what to do. So I just I was going through this at the time. So I decided to put together 30 minutes just on that journey of what I had been through the last few years. And I had never gotten feedback on anything like I got feedback on that. And so that was great. I realized maybe there's something here, capturing something in the zeitgeist at the moment. And then, of course, March happens of 2020, and now I'm at home for 8 hours a day for the next, or 24 hours a day for the next 8 weeks. And I had time to work on stuff, right? And so that's when that 30 minutes kind of turned into 60 minutes, and 60 minutes into 90 minutes. And I don't know if you remember, but there was a lot of webinars going on during COVID. Everyone was doing webinars all day, every day.
Very guilty of that, absolutely.
And so I had a chance to do a couple of those webinars, like for Kirk Barron and different places. And, it turned into I was getting a lot of feedback on it. And of course, we were all struggling at that time because of the pandemic. But then coming back from the pandemic, I think it was Scott Frank's group in Chicago asked me to do a half a day on it. And that was the first time I had done that much time on it. And so it ended up kind of growing to include more stuff than just my journey, coping mechanisms, things that like action plans that dentists and dental team members could add to their lives to hopefully help treat this a little bit, different types of therapy, what may be effective. And then I started adding stuff about what I realized is not only are we not good at caring for our mental health, we're also not good really at understanding patients and their mental health and their mental diseases as we treat them. And so kind of adding in sort of more of the clinical part about how we would treat a patient that may be suffering from mental disease, or maybe taking antidepressants or antipsychotics or anti-anxiety medications and things like that. And so then it kind of became this more well-rounded, like kind of full-out half-day program. And so it was one of those things, like it was just, what the old saying is something like, luck is when preparation meets chance or opportunity. That's what it was. It was preparation and opportunity, like right at the same time. It just happened, right? And so now I think it's probably the best program I do. It's my favorite program to do, is to talk about mental health. I was just at Cinco Fuel's study club, the Thunderbird Study Club in El Paso, Texas last week, and full teams. And it's such a enjoyable experience to share all that with them and have them react and all the things. There's a lot of jokes and stuff like that in it to try to keep it light and fun.
Yeah, you could be a little funny sometimes.
I'm from time to time.
I'll give you an unsolicited plug here, Josh, and this program in particular is one of the best we offer in the network. So anybody out there listening, you've got to take the opportunity to hear this one somewhere, sometime.
Well, thank you. I appreciate that.
Now I'm going to come at you. How do we define mental health? I think everybody's got a different view of what it is. It's almost like case acceptance. Your vision of what case acceptance is different than Bill's or Eric's or anybody else's.
Yeah.
So how do we define mental health?
Yeah. To me, it's about like being Kyle Stanley, who also coincidentally talks about this as well. And Kyle and I kind of came up through the same speaker showcase with Seattle Study Club many years ago in Kona, Hawaii, I believe. And Kyle talks about being resilient, right? And I think that's a big part of it, right? Like you have to understand in dentistry and in life, because dentistry is just a microcosm of life, like things aren't always going to go your way. And I think being mentally healthy means the ability to be able to handle that, being able to process that, get through that, solve the problems, and then, be able to continue on and have a great home life, have a great life with your friends, have hobbies, like have all of those things that make us like well-rounded people, right? And to me, that's kind of what mental health is. It's like trying to define overall health, right? Like how do you define overall health? Well, it's kind of like, to me, it's like to be able to do what you want to do at any age, right? That's kind of, to me, like what being healthy is overall, right? And so I think it's the same kind of thing here. Like for me to be able to make it through my day without plummeting into deep depths of depression or anxiety or panic attacks, but at the same time also like maybe kind of stoically, like not getting too high and too full of it when things go well too. Like being neutral, sort of even keel the whole way, being able to handle things that come at us. Meanwhile, knowing like, hey, there are going to be natural ebbs and flows. There's going to be times where you're feeling better. There's going to be times where you're feeling worse. But being able to persevere that, be resilient through that, and make it through to the next chapter. That's kind of my thought.
Love that definition. So let's do a little rapid fire. I'm going to throw a few words at you from do these define mental health? And it's just, you can elaborate if you want, but I'm really looking for yes or no answers.
Yeah, sure.
A stress-free life.
No, it's never. There's no such thing. I mean, I don't know. I guess if you were Jeff Bezos and had, $14 billion and could live on an island, maybe then. But like, no, it's for a dentist. No, it doesn't exist. Yeah, exactly. Doesn't exist for a dentist.
Happiness.
Yes, of course. Now, what makes each of us happy is totally, defined differently, right? So yeah. I think that's for Andrew Robbins, my associate, and your son, watching films makes them super happy. I like watching films, but it's not necessarily what I would say like makes me the happiest thing in the world, right?
Yeah, 100%. It was interesting. I heard the other day somebody split hairs on happiness. They said happiness is a feeling. The cognitive equivalent of that you have control over is satisfaction.
I like that. I like that a lot. That makes a ton of sense to me.
Because you can control, right? Even in stressful times, you can, I handled that relatively well, or I could have done better, but here we are. So
It's more like me. I always could do better. I know that.
Absolutely.
I know that.
All right. Next word would be self-actualization.
Sure. Absolutely. Absolutely. Some of I think we've mentioned him a couple times. Bill Robinson knows exactly who he is. He knows exactly what he's about. He knows exactly what his values are. I think Todd is the same way. Todd's a great example of that. Simon is a great example of that as well. Like I think knowing who you are, knowing what you feel, knowing what you believe in, I think that's absolutely real.
Yeah. So give us some tips, coping mechanisms. What are
Yeah.
you doing on a daily basis? What are you recommending people do in that moment when the hygienist calls in sick, when my
Yeah.
boss yells at me because Gary's a punk, when Eric calls and wants to talk for 2 hours?
Yep. The best strategy we have, and the thing that you have with you at all times, no matter what, no matter where you are, is your breath, right? So breathing makes everything better. So stopping to breathe for like even 30 seconds can be like super calming and allows your brain to kind of start getting into executive process to problem solve, right? So what I find is when I'm most stressed out, I'm holding my breath. So that could be like technically, like dentally, I'm doing a procedure and it gets really hard. Like I oftentimes find that I'm holding my breath. And so like just stop and like get 2 good nasal breaths in. And I do this thing called Ujjayi breathing. If you've ever done yoga, you may have done Ujjayi breathing before. It's basically like an inhale through the nose, and you make this slight constriction in your throat, and it sounds like this. So it's like constrictions that you exhale. So imagine you're trying to fog up a mirror that's underneath your nose, but you're doing that through your mouth, right? And so if you just do like 2 of those, it kind of resets everything. It's really crazy how beneficial it is. Along those same lines, you need a little bit longer than 10 seconds to do this, is a guided meditation, right? I love a guided meditation. I'm not good at meditating on my own. I need to follow someone's voice. I need to have a guide so I can stay focused on it. And there's a lot of ways that you can do those. There's YouTube's videos of guided meditation. There are podcasts of guided meditation. There's apps that work really well. There's actually one that has a collaboration with Seattle Study Club called Trigger Point that works really well. It's just 5-minute guided meditations. I throw on my AirPods. I close my office door. I put on a sleep mask that I have in my backpack, and I'll just sit for 5 minutes. I try to do that once a day. It's at various
Once a
times
day.
during the day. Yeah, once a day. Like sometimes it's in the morning, sometimes it's at lunch, sometimes it's at the end of the day. Just 5 minutes. And these guided meditations are always so great because they're so calming, and they talk like this, and they talk about breathing in. Many times they're also British because British people sound so much better than we do. Breathe in and breathe out. It's like it's so good. No one wants a stressful voice doing their guided meditation. No one wants to listen to Donald Trump doing guided meditation. A lot of
No.
people talking about guided meditation. Let me tell you, it's tremendous. It's tremendous. People are talking about it. People are saying we're the best at meditating that's ever been, and I
And it
think we
would be
are.
in all caps.
I think we're the best. Thank you for your attention to this problem.
Yeah.
Yeah, no one wants to listen to that. No one wants to listen to that. So guided meditation like once a day. So stop and breathe when you're feeling that moment, you're feeling that heat. Stop and breathe for 30. Guided meditation once a day. Something physical during the day. Doesn't
Do
have to be a
something
marathon.
physical, like
Yeah.
exercise, you mean? Or
Yeah, here's the problem with exercise. And Americans feel this immense need to over exercise, right? So I hear this a lot. If I don't have an hour to go do like a workout that I'm so physically spent afterwards, my hands are bleeding because of the gnarls on the dumbbell. I'm like in a pile of sweat. Like it's not even worth it if I don't have the time to go do that. And it's not about that at all, right? Like you don't have to run a marathon. It's like walking for 15 minutes outside with your dog or your kids. That's all. Just do something. Do something. Like do something outside if you can, weather permitting. You're in Seattle, so it's cold and rainy sometimes, and maybe you're not able to. But if you can get outside, move your body for even 15 minutes, like it. What that does, it does a couple things for you. Number one is it releases endorphins, and endorphins stabilize your mood immediately. They're basically nature's anti-inflammatory or nature's antidepressant. And it releases dopamine as well, because you always feel good afterwards. You feel some sense of accomplishment that gives you a hit of dopamine that's involved in your motivation and reward pathway in your brain. And so it gives you that sense of satisfaction, which we talked about earlier. So like those are the three things. There's another way to get endorphins. I don't think we can talk about it. That is sex, either exercise or sex, either one is a great thing to do to get that hit. And I think if you do those things, I think those three things alone will really help. I think on a weekly basis, anybody who works in dentistry should be doing yoga. And I know that your wife is a big yoga person. Yep. And it's like, people think it's like, oh, it's spiritual. It's like, oh, it's like new age. And like, I'm not into that at all, but like all it really is stretching and breathing. And it's all core. That's all it is. And that's what dentistry is. That's why people hurt their backs, is because their core isn't in shape. And so if you spend an hour a week doing yoga, there's a study in the hygiene literature that showed that dental hygienists who do yoga an hour a week have longer careers than hygienists that don't. So it's like, all right. So that's like a huge thing as well, is adding yoga like an hour a week. Again, you don't have to go to a yoga studio. You can do it on YouTube. Like there's yoga lessons on YouTube.
That makes some sense to me. So we've talked about sort of the daily things that we can do, right? So when you feel that stress or that moment coming on, the breathing, the meditation, even if it's just a few minutes. You said you do 5 minutes a day. Can we get ourselves to do an hour of yoga a week, just to, again, sort of reset? And even if it's not yoga, if you're just stretching and breathing, I mean, that's functional there. Let's back it up 10,000 feet and talk about bigger picture. Are there ways to balance your professional life and self-care from a calendar year standpoint?
One thing that I highly recommend to everybody is to get off social media for like a week or two a year. Just like get off of it. Just take it off your phone, get off and just don't check anything. Don't read anything. It's like I have realized that what I've started doing is the first thing I look at when I get up is a news source. And I don't know if you've noticed, Greg, but over the last like year or so, it seems like every day is like we are this close to disaster every day. And so it's probably not the best way to start my day. And so, just trying to get out of those patterns, I think is really, really important. So I think all of us need to take some time off of social media. I try to at least layer those two on top of each other, at least a few days a year where I won't be on social media while I'm on vacation. Of social media vacation and my vacation layered on top of each other. That's really nice. It means that I can't, post the pictures of me without my shirt on at the beach, which is a huge loss for no one. No one.
It is. It's a loss for all of us, actually.
No one wants to see this, Greg. No one wants to see this. I think I might be pastier white than you.
Yeah, we can have a contest this January.
No one is going to come to this contest.
Speedos on stage. Who's whiter?
Oh my God.
So I've got two things for you there. One, and I started doing this recently. Somebody recommended to me, because when I got up in the morning, first thing, my phone is my alarm clock, right? So first thing, and then the notifications are there. So I'm either on social media or checking text messages or emails. And they said, you need to plug your phone in on the other side of the room or downstairs and get yourself the old school alarm clock that we all grew up with. I've been doing that for a week. I don't touch my phone until after I walk the dog, and it has made a huge difference.
That's amazing. I love that idea. Where did you even buy a real alarm clock? That seems like just one of those things that just like has gone, that it's, only people over 40 will remember actually having a device that was an alarm clock.
Yes, I'm sure my purchase of the alarm clock helped fund Bezos' wedding. So
there it is. That paid for Sydney Sweeney to fly in.
That's right. In her blue jeans. Absolutely. So that was one. So try that.
That's a great idea.
And this was from Michael. I heard this from almost the day I started with Michael, but I have heard him tell countless clinicians this. When you're thinking about your vacation, you need to plan 2 years out. And when you block those dates, they're inviolable. Like once you say, whether it's a long weekend or a 6-week, whatever people are doing to fit you, but it should be done 2 years out. And
I like
then
that idea.
you don't, it's no longer stressful and you're no longer trying to squeeze them
Well, that's
in.
it. You're always end up wedging it in, right? Like, oh, I've got
Yep.
this thing, and then we've got this. Oh, Friday's a busy day, so we'll leave Friday night. And yeah, I totally get that. It's a great piece of advice from Michael.
Yeah, I mean it's the same thing as pay yourself first, make your investments first, whatever it is. But people don't do that. It's what's ever left over. I'll find a way to make it work.
I'll take the scraps, right?
Yeah.
Yeah, stop
Okay,
eating the scraps.
let's shift gears a little bit here for just a second to wrap this up, because presenting on mental health and its applications in the practice and in your daily life isn't the only thing you're doing. You're doing a lot with Align. You're doing a lot on comprehensive dentistry. Talk to me about that a little bit.
Yeah, so Align has come on and been a partner of Seattle Study Club the last few years, which is great, and they're a great company, and they're honestly, obviously, the industry leader at clear aligner orthodontics. But I think more than that, clear aligner products to me is like the tip of the pyramid of what Align does. To me, the base of the pyramid, what the foundation is a machine called the iTero, which is a digital scanner. We all bought them to make crowns, to scan for restoration, right? But like that's 5% of what it does. What I have found is that machine is an incredible machine at getting patients on board with treatment, because they can then see their teeth in 3D high definition and all these different views that show things like wear and recession and malocclusion and things like that. And so if you want to have comprehensive dentistry discussions with patients, you need to show them, they need to be able to see. It needs to be done with co-discovery, right? That's something we've heard time and time again. And for many years, co-discovery meant diagnostic models mounted on an articulator. It would take hours of time. And now you can generate that in 2 minutes. And so once you add that in, you're going to start, it's going to become so much easier to start talking about comprehensive dentistry, because you're going to see it on the screen of the scanner. Then it just becomes executing that dentistry, right? And I think adding tools like orthodontics to your practice, either as something you refer out as a GP, or something you may do. And I do, probably 25% of the orthodontics in my practice. I know what my skill set is. I know what my comfort levels are, and I still work a lot with an orthodontist. But I can do some stuff to help make my restorative outcomes better, right? And so learning all that and being able to teach that to other dentists, and even if it is like, hey, we're still going to work with the ortho. Here's the things that I want. Here's how we use the software to communicate that, so we know where the teeth need to be, so that we can restore them the way we want to restore them. And there's a new tool now that basically allows you to do digital smile design chairside with a photo and a scan and a video. And all that stuff takes about 5 minutes to get, and you can show a patient what they'll look like after ortho, what they'll look like with a full mouth reconstruction, what they look like with veneers. All of that on the screen. And you can do that with
the video as well.
Absolutely, yeah. A photo and a video with the iPhone or any smartphone, if you're an Android person for some weird reason. I don't know why anybody would be. But yeah, just a scan and a photo and a video literally takes less than 5 minutes to do. You can take a patient through an entire presentation.
That's a killer app. I mean,
it's unbelievable.
You started out talking, or not started out, but early on you had mentioned DSD. And when Christian first introduced the emotional mock-up.
I believe he did one on you at a symposium.
Yes, he did do one on me on stage. But when he did it, he started with stills. Yeah. And when he moved that motivational mock-up, motivational, not emotional, motivational mock-up to video, it was a game changer. Yeah. When people can see themselves in motion and talking and laughing and smiling with that new smile, and now it's even easier, is what you're telling me.
There's no lab work involved. You can literally do it on the screen of the scanner within 5 minutes at an initial consultation. It's unbelievable. And I'm just a big proponent of, like, a patient can't say yes to what you don't talk about. And so I'm sure you hear it all the time, like, oh, that's not my practice. I don't have those kind of patients. You do. You just got to talk to them about it.
Yeah.
And the other thing is
LSUV. If you're not looking for it, you're not going to see it.
That's exactly right. And the other thing is you have to be comfortable hearing no. I have to say that so many times to dentists, but it's no skin off my back. I'm kind of a libertarian. Like, it's your teeth and your choice. And so if I present a treatment plan to somebody and they don't say yes, it doesn't offend me. I was joking around the other day. My nephew is in college. He's at LSU. And I was telling him the other day that I went to college before they had dating apps. So if you wanted to talk to a woman, you have to physically approach them in an establishment, a restaurant, a library class, the bar, whatever, and actually physically talk to them. And this blew his mind. He was like, what are you talking about? He's like, what if they said no? I'm like, yeah, that's why I'm so good at hearing no now. I heard it a lot when I was in college, believe me. A lot. Every night. Every night. So yeah, I mean, that's the thing about comprehensive dentistry, especially for younger dentists, is the only way to get there is to talk to patients about it. And if someone says no, it's fine. No today doesn't mean no forever. No today means no today. You never know. This happens to me all the time. Most of my comprehensive cases are honestly people who have been in my practice for at least a couple years, and we've talked about it a couple times, and it takes them some time to get to the point where they're ready. Every once in a while, somebody that comes in that's ready to rock and roll, that's ready for ortho and pre-ortho bonding and this and that and the other thing, crown lengthening and implants and whatever. But most of the time, it's people that have been in my practice for a bit. And then, at some point, it becomes their day. And for what reason, God only knows. But you just have to talk to people about it. And so that's why I love the yellow SUV thing or the yellow car thing, because it is so true. Like, you don't see what you're not looking for.
Brilliant. So I've got two takeaways from this. One is Ouija board breathing. And the other that I really love, which you in essence are closing with, is no today doesn't mean no forever. That hits me. I get it. So I want to thank you for just spending a few minutes with us. I really appreciate it.
Anytime.
I'm looking forward to seeing you in January, twice in January.
Yeah, because you're coming to our study club like the week before, the week after, right?
Yeah, the week before symposium,
yeah.
And then we'll see you again at symposium.
It's going to be great. Our study club has been going for like 20-something years now. And we all realized, we started our study club before you were part of the early phase education in a study club. And so you've never been to our study club.
Never been.
And so you've done almost every other study club in the country. You haven't done ours. And so we're stoked to have you. I'm super excited to do it. In fact, I blocked off a Friday for you that I'm not being on the road. So
amazing. Oh, I'm really looking forward
to
it.
My wife says I won't even do that for her. So this is a high compliment for Greg Tice.
Well, I'll come dressed as Paul Hollywood and we'll be all right.
Let's do it. I will dress as Prue. And we will whip up some gingerbread or some chocolate chip cookies or something, or as they would call them, biscuits.